this is Kelly Meerbott, host of Hidden Human, and today we have board-certified family medical physician, Dr. Lily Girson, who's also the founder of Mindful Medicine and Wellness, a practice in Narberth that works with Eastern and Western medicine. And we're going to talk about how to take your power back as a physician from the healthcare system, how to advocate for yourself as a patient, the importance of DEIA in medicine and healthcare, and how to build your own medical practice. So take a listen and make it a great day. I am so excited. I know I say I'm so excited every week, but I am so excited because there is somebody on with us who is not only a badass board certified family medical physician, she's also the founder of Mindful Medicine and Wellness, which to me filled a huge gap on the main line. And this is the title I give her. Best doctor on the main line, Dr. Lily Girson. And to be transparent, she's my doctor. So I absolutely adore her. Thank you for taking your precious time currency and spending it with us for an hour.
Thank you, Kelly. Anything for you, really.
I mean, I adore you. You know that. And let me just tell a quick backstory. So when I say Dr. Girson really saved my life, she did, because last year I was, and I've said this, I haven't said it on the podcast, but I'll say it now. Between January 2023 and July 14th, 2023, I wanted to kill myself 5 times. And I don't say that flippantly, but for me, that was an alarm clock, because what I said to Dr. Girson is, at the core of me, I'm a little kid who likes to create mischief, play, and change the world. And like, that was a very vast departure. And she looked at me and said, tell me more. Listened, and not just listened in that physician way where they look down at the clipboard, look at you, nod, blah, 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 but sat there, connected with me, and listened between the lines. And we figured out that I was in menopause, which I definitely want to talk to you about that. But really, she helped me work through a plan. We worked together collaboratively on my health. She's taught me how to be a better advocate for myself and given me hope in the healthcare system. So all of those things is just a small sliver of who she is. And I know I've thanked you before, but thank you for being you. You're just amazing. So tell me, because I know you have 3 little boys at home, if you were going to explain to me, like a 6-year-old child, in a way I can understand what it is that you do, what would you say?
When, hearing you say that I was, listening to you and sitting down with you and, working through it, I look back at those days now when I was working in like traditional medicine and thanking God right now that you actually like felt that way, that I was like, and I was, but that you felt that way. Because I feel like in the world of like traditional medicine, it's like a never ending hamster wheel of seeing patients, and you don't get that opportunity as a physician, even though I think most of us want to and, strive to have the time and the compassion and everything to hear your patients. But I think that, ever since, starting my own practice and doing this, haven't felt that worry that like, am I there enough for my patients, or am I, doing this for my, like, I know that I am now. Whereas that was what I was always striving to do back then in a world where you had 12 minutes with your patients. So, I really just try to, be an advocate for them and listen to them and, give them the care that they need and that they deserve.
I remember as you were talking, there was my sleep doctor in Virginia who just diagnosed me back in 2010 with sleep apnea. And and I'm such an asshole sometimes, like, I'll just be real. Like, he's sitting there and I see him and he's not looking at me. He's just looking at his clipboard. And at one point I got really mad and I go, eyes up here, patient's not on that clipboard. And he looked at me and he was like, oh my God, I'm so sorry. But it happens more than we would like to say. And, to be fair to the doctors, like, you're not the only one. And he went from practicing at Penn to practicing at Penn, their concierge service. And what he was saying was exactly like you. He said, if another NBA came in to shorten my time with a patient and asked me about the ROI, I wanted to like scream and pull my hair out. So he went from like 2,500 patients to 500 patients, which, you know, with my grandfather as a doctor, you know, I know what good medicine looks like, and you and he are it.
Do good care. If there's, you know, I had a 2,000 patient population. It's like insane.
Well, and the difference I will tell you, because I was at Dr. Gerson's old practice, and the difference from the patient experience was I didn't feel like there was this looming pressure over me. Like, you know, I'm sure you experienced, you know, and I know that I was getting that from you, and that's really no fault of yours. It's just the system, unfortunately, that we've got right now. You're just choosing to do something different, which I always love. You little rebel, you. Um, so can you share with me a pivotal moment in your career that significantly shaped your leadership style?
I went into medicine. I knew I wanted to be, you know, I did a roundabout way into medicine. So I majored in journalism and Spanish in undergrad. And then I worked for a newspaper for about a year and a half. And then I said, you know what? I've always wanted to go into medicine. I thought about it when I was in undergrad, but I didn't want to take the time. So I made the leap at this point, you know, a year and a half after graduating. And I went back. I did all my sciences, like a post-baccalaureate program, did my the MCAT, got into medical school and did all of that. And I was like 27 or something when I did all of this. So I always like knew I wanted to be in medicine. When I was in medicine, I was disappointed. I was like, I worked so hard for this. I literally spent 9+ years in schooling for all of this because I had to go back and do all of it. And I thought it would be different than what it was. And I always told myself, I would always like saw myself as a very empathetic person. And I felt that in the world of medicine, my empathy was like draining, which is what you need empathy in medicine, like 100%. And it was like the, you know, higher ups, the CEOs who have nothing to do with medicine. It was the insurance companies who know nothing about medicine and, you know, telling you what you can and can't do, denying things, having you, instead of like working for the patients, like fighting them to get something covered, you know, that was necessary. And it was just very draining. And so I think like a pivotal moment was when I decided to leave that and do this so that I can give patients the time that they need. I have my empathy back. And I think that was like the best and biggest thing that I could have done.
I remember you were in all of these interviews with all of these corporate entities, right?
I was on a text with you. You were wonderful. You were so helpful during all of this. And after I left my last job, we took a little like week-long vacation to Florida with the family. We took them out of school. We were like, okay, let's figure out what we want to do. And I remember being on the plane and texting, and you said, you know, what have you decided to do? Or what are your goals? Or what are this? And I was like, you know, I really want to do this, but I'm just fearful because of all the unknown and the expenses and the this and the that. And you were like, just do it. You know? And I was like, you know what? You're right. And here we are today.
Anytime I say this, I'm like, I don't want anybody, because you and I both know we have privilege, right? Like that's a real thing. And I try to leverage that to help other people. So when I say what I'm about to say, like everybody has their own story and you got to figure out like how it works. But listen, and this is not bagging on me. I am not that smart when it comes to things, right? If I can build a business and have it 16 years later, so can you. You just have to be resourceful and find a way, you know. And I remember Rich Litvin, he was one of my coaches that started me out in 2009. And he goes, Kelly, all you got to remember is MSU. And I was like, what the fuck is MSU? Like, what is that? And he goes, make shit up. And I was like, oh my God, you're right. You're right. Now, obviously, when we're talking about the IRS and things like that, follow the rules, people, because nobody wants the IRS.
You know, all of that.
Right, right. I'm not advocating for that, but what I am advocating for is don't be afraid to try something. If it's uncomfortable, that's okay because that could be something different. And like you made it up, right? Is there any other practice like, your practice out there? I don't know.
I don't think so. To
I
be
don't
honest,
think so either.
we do, a mix of Western medicine and Eastern medicine here. I've partnered with Larry Mangle, who's the president of the Pennsylvania Ayurvedic Medical Association, to do a lot of like the Eastern medicine, herbal supplements, all of that. I did it because at my last practice, at the traditional practice, if you don't have a patient on a statin with their high cholesterol, you get dinged from the insurance company. If you don't have, the colonoscopies on, which you should do anyways, but like you get dinged. There's so many like things that you're just checking boxes off of rather than like listening to the patient. And I had a ton of patients who were like, I don't want to be on a statin for my high cholesterol. What else can I do? And, in that world, you're like, no, you're going to be on a statin because otherwise, like, Medicare won't pay me. Or, like it was such like an eye-opening experience that like patients just, they wanted alternatives and they wanted this. And there are still those patients who are like, yes, give me that statin. And 100%, I think statins are amazing. But I also want to listen to the patient and do what's best for them. And so that's why I wanted to like offer kind of both worlds of this. You can, we can work together and collaborate and do labs and see how things are progressing. And so I think that's really helpful. And then, I've always also wanted to do aesthetics. I grew up with my dad's a plastic surgeon, and I think he was very disappointed when I decided to become a family medicine doctor and not a plastic surgeon. But I did really like all of the, aesthetics part of it. So in my prior jobs, I'd always asked, can we do it? Can we bring this on? And there was so much red tape around it with malpractice insurance and this, and like nobody wanted to do it. So now that I'm on my own, I can do what I want, which is great.
Yeah, it is kind of fun. It's like when people ask me, can we do this with you? I'm like, you are talking to the CEO. I think so. You know what I mean? Um, but what's popping in my mind since we're talking about like patients advocating for themselves, I think there's this dynamic, not with you, obviously. Like I feel like we're partners in my health, right? But there's this dynamic where you walk into a doctor's office and doctor's here and you're here. How do you what actionable steps can people at home take to make sure they're advocating for themselves, especially when the doctor's not listening? And what's the tipping point to be like, you're fired, I'm finding somebody else?
I think it's really hard in traditional medicine to, have a doctor really fully listen to you unless they're like, running 5 hours behind and then the patient gets upset, but then they're giving the time devoted to the patients, but, someone's in the waiting room waiting for 3 hours. So I think it's really, I don't know. I think it's hard in that sense. But I think what you can do is, the tipping point too is like, it's just what you're like, your borderline, like what your, what's the word I'm looking for? What
The boundaries, like what your gut is telling you.
I think it's different for every single person. Some people tolerate, that a little bit better. And some people are like, no, I want more than this. So I think it's really personal.
Yeah, I do too, and I think it's different for everybody. But I would say don't be afraid to bring somebody else in. If you can't speak up for yourself, bring somebody that is trusted in your world to help you.
I would say 100% I want to agree with you, but it's so hard, and I think in the world. But you do what you can.
So, how would you describe your leadership philosophy, and how would you say it's evolved over time?
I think I have a decisive leadership quality, and I, along with like being patient-centered. I think it's kind of like a mix of both. I will say that I was never good at making decisions until I went into medicine. So I think that has evolved. You kind of learn like with all, the continuing education and everything that you're learning from. And just communicating with other people, kind of what's right and what's wrong. And you said, like, I don't want to say you make shit up at all, but it's like you know what you know, and you have the confidence to just, this is what it is. Like, it's really funny because I can't decide for the life of me what restaurant we're going to go to. But if it's like for a patient, it's like, this is what we're going to do. What do you feel about it? And I always like, the patient centered part is, I'm never like, this is it. This is how you do it and see you later. It's like, how do you feel about it? What do you think about this plan? How can we make it work to work with you, like along these lines? So I kind of think that's how I work.
I would say, as your patient, I agree with that 100%. Because I remember you asking me, like, literally you pulled up on the internet all of the symptoms of menopause, and we were like, yep. Okay, let's get the test to make sure. And this is what I think you should do. And it was like, you gave me a medication that I told you it felt like it opened up a vein in my brain and shot out happy endorphins. And my husband, like 24 hours later, was like, there you are. You know what I mean? And I told you that. And it was like, it was life changing. It was life changing, and for me, I'm one of those people that believes in medicine. I don't believe in pulling the script pad for everything, but I do believe in the power of good medicine when it is applied properly. Yeah. So what would you say the most challenging leadership situation has been that you've been in, and how did you navigate it?
Starting this business, it was scary. It was, I have 3 kids at home. We had a very steady income, working at another place. And it was like, okay, am I going to be miserable and like stay in this, or am I going to do something about it? And it was like that leap that, with your help, I knew that, I could do it and I could handle it. And I was a good enough doctor to be able to do it. And I think, I just think having the drive, and it was also like, it was kind of incredible. I mean, I don't want to toot my own horn, but I feel like it was incredible because I incorporated like at the end of February and I opened like the end of April. So it was, I'm a very driven person. When I put my mind to something, it's going to get done. And it was like every day I was working on something, and my husband just kept telling me, like, like, be patient. I'm doing all this waiting. And he's like, there's nothing you can do about it. You have to be patient. And, finally the ball just kept getting, rolling and rolling. And here we are. So I think that was like the biggest challenge and the like success too.
If you don't mind me asking, and if you don't want to answer this, that's okay. How many patients do you have now?
I have 55 patients.
What's your goal on paper?
I was going to do 15 patients a month. So I have May, June, July, August, 15, 30, 45, right there, basically.
You are right there.
You are
right there. And yeah. She, just to reiterate, she opened April of 2024.
Yeah.
And the worry that you said to me was, what if I don't get any patients? I was like, it's not possible.
Yeah.
It's just not.
And here we go.
Yeah.
Day one, I like literally put my website up and I got 2 patients. I was like, wow.
And I love that it's membership based. And I love that the way you did it was age. You know, like you fall in this bucket, this is what it is. You fall in this bucket, this is what it is. And to me, it's not unreachable. Like Pens is $7,500 a year. And I think, what do I pay in the middle tier?
So you're $119 a month.
It gets me Dr. Girson. Like if literally she responds within less than 24 hours, sometimes within the hour that I text her about something.
So that's what like direct primary care is. I kind of say it's like concierge, but for an affordable rate. And also with concierge, they also take insurance. So at each visit, you have your copays, you have your deductibles, all of that. Like with the direct primary care, the monthly fee gives you everything. There's no copays per visit. There's nothing like that. And I kind of say jokingly, but it's true, it's probably, similar or even cheaper than your monthly cell phone bill.
Oh yeah. Let's see. It's $120 cheaper than my cell phone bill.
Yeah. there you go.
So talk to me about the leaders that have inspired you the most and what lessons you've taken from them.
Honestly, this may sound cheesy, but I think my husband is a pretty great leader. I'm really impressed with him. He also is a kind of, self-made. Um, he started his own business back when we were like right out of college, and it has just like thrived. And it's amazing to see what like starting this now, and knowing all of the barriers that you had to get this done, and seeing him like just do it. It was amazing, to help me do all of this. And I think, he's a very calm and collected type of man, and I'm the complete opposite.
That's you just described my relationship with my husband too.
So, just looking at him and being like, okay, I think between the two of us, I think we're a really great team, because he said, like, during all of this, he's like, I think we need each other, because you get me going and doing this, and like you're not patient, and I'm here to like kind of bring you down a little bit. So I think, seeing how he has built his business and done all of this, and I mean, he was out when we were like literally straight out of college, and our friends were out partying or doing whatever. He was like, I have to go work. I have to go do this. And so he's got an amazing work ethic. And just seeing him, really build it from nothing has been pretty awe-inspiring.
And that's not cheesy at all. And I will say this, I've had the privilege of being at Lily's house and for like a hot minute, but they do have three very active young men. Active. They are very sweet and very funny. But what was really interesting was I was there around dinner time. So it's a little bit chaotic. And literally, Lily and her husband were steady, steady. There was no yelling. There was no, now, but I will tell you, there was some discipline going on, but it was very firm, assertive, and gentle is the best way I can say it. So I agree with you. I think you two make a really good team, at least from what I saw. So you're building a team right now. And I know you've worked in teams before, but how do you build a strong team dynamic and foster collaboration?
Really, the biggest thing is communication. I think, working together, and not just, I think you need a leader in a team, but I think you need to also, gather input from everybody, kind of get everyone's idea of kind of what could work, what could not work. Review, all the opinions, review alternatives, like all of that, that everyone has to bring to the table. And then, kind of implement what you all have decided on. And, all along the lines, I think just communicating, I think that's the biggest thing that you could do, really.
It's so interesting to watch teams that don't communicate well and the impact of that on the organization. So I think you're 100% right.
I was also going to say, kind of based on like what you do, I know a lot of like bigger companies who are, working on fostering teamwork and all of this are, hiring coaches to help with that, to help with like, communication and figuring out, what works and what doesn't work and what you can strive for and all of that. So, I definitely think, you are needed as much as a part of that as well, too.
Thank you. Thank you. I was talking to a colleague of mine earlier this week, and I remember when I was a little girl, I loved my grandfather so much. And he passed when I was 16 from non-Hodgkin's lymphoma. But I wanted to be like him so badly. I wanted to be a doctor. And then I took organic chemistry, and that literally changed the trajectory of my life. I became pre-med. No, I went in pre-med biology, and I graduated English lit with a minor in women's studies and writing. But I like prayed, and I wanted to do what he did. And now as a coach, I feel like I'm a healer in a different kind of way. So that, for me, that's, yeah. I mean, I really think everybody needs a care team around them, meaning who's taking care of you spiritually, who's taking care of you emotionally, who's taking care of you physically, and if you can do that, I would say do that. And if not, find people in your world that can fill those roles until you can have a care team. So you and I both know, and we've talked about this many, many times, but I would love to hear from your perspective why diversity, equity, inclusion is important in leadership and in medicine, and how do you implement these values in your practice?
I think diversity, equity, inclusion is so important. People come from so many different backgrounds to give so many different perspectives. And if you don't have that, you aren't looking at all sides of the picture and you aren't seeing all sides of the picture. People bring in so many different viewpoints, ideas, all of this. And, and I think a lot of it kind of will stem from people's different backgrounds. I'm a big proponent of, it's funny, like I was the co-chair of the diversity club when I was in high school. So this has been like a big part of my life kind of throughout. I want to say like how am I like implementing it here? I'm the only physician here right now. But I actually I have my patient population is very, very diverse, like even amongst the 55 people that I have. I think just being like a good natured human who's, not a bigot and inclusive to all would, I just think that's the way of this world right now. It's a little bit insane, how, I mean, even, as a Jew right now, this is pretty insane what's going on. But I just think, communication and like, I think going back to all this, I think communication is the biggest thing because that leads to, if you don't have communication, you're basically like have ignorance. And ignorance is what drives fear and what drives like all this unknown and makes you have these ideas in your head of what you think it is, but what it's actually not. And just, learning about other people and, being open to different viewpoints and ways, I think is like the biggest thing that you can do.
So our mutual friend Mel and I were having a discussion, and she said something to me that woke me up, and I was like, holy shit. She said, doctors are to Black women as cops are to Black men. And I was like,
she's not wrong. I mean, there are so many studies that show, that Black women, even like in labor, labor and delivery, have a higher death rate than white women. And, you kind of think about that. And I think a lot of it, and I would hope, just kind of being in there, like it would be a subconscious thing that's, a bias that people have, but it needs to change. It needs to change.
We talked about possibly getting into this, so I'm just going to go right at it. With the overturning of Roe v. Wade, I mean, is that going to impact white women? Sure. Is it going to impact the way other underrepresented communities show up? Yes. Yes. And what I wonder is like, obviously it's impacting, I don't think people understand like how many people it's impacting. It's impacting the woman. It's impacting her family. It's impacting the doctors.
I don't provide abortion care per se. I give my patients the options and choices if they ever need to go that path. I am 100%, pro-choice. This is your body. This is what you do. This is your life. But I know as a doctor, I have friends who do, perform abortions and, whether it's elective by choice because you just can't handle that in your life right now, that's your choice. Or if it's, to save your life, you have to do it. And, like doctors are so fearful to, do this. I mean, even like luckily in Pennsylvania, it's still okay right now. Who's to say that's to change? But I do know, based on, white, Caucasian, Black, white privileged women, and not to say that there are not Black privileged women, but white privileged women usually have a easier time, crossing state lines, finding other options, doing this than, the young Black woman from, center, I don't know what, in, the middle of Louisiana or something, who leave and can't go find other resources. So there's definitely, there's a huge issue going on right now.
Regardless of what the other side says, meaning, oh, it's not a big deal. It is a very big deal. It is a very big deal, because if they take that freedom away from women, it opens up the door for other things. LGBTQ, I mean, everybody's going to be impacted by this. So
I had somebody say, what if they had a bill that told men that they can't ejaculate? It's like, that's controlling their, that would never fly.
Right. And that actually brings me back to my story, because I said to you, remember, you were like, I think we need to put you on HRT. And all of these more seasoned women were saying to me, don't do that. Don't do that. Don't do that. And I said, why are they saying that to me? And you said, because it's old school thinking. And if you were a man, I'll never forget this. You were like, there would be a patch, there would be a pill, there would be a Pez dispenser, there would probably be a vape. And I was like,
you're right.
What the hell? So,
right.
Yeah.
True.
Yeah. Yeah. And I mean, I always fall in love with you. Like every time we're together, and like, I was like, she's the shit. And she's exactly right. She's exactly right. Okay. Are you okay with doing some rapid fire questions?
Definitely.
Okay. Yes. So what's your favorite comfort food?
Tomatoes, spinach, and pineapple pizza.
Interesting. Is there a place that you like to go to?
What is it? Rock Hill Pizza is really good.
Good to know. Putting that in the back of my mind. Okay. What books are on your nightstand?
Currently, it is the Heaven and Earth grocery store.
Okay. That's interesting.
So good.
What songs are on your playlist?
Anything Kygo.
Interesting. That's interesting. I like that. Is there a favorite song that you love?
Oh my God, I'm so bad with names.
That's okay.
Heard the song, I'd sing the entire thing.
All right. Well, I know I'm going to walk into your office next time playing Kygo.
Yes.
What are you most grateful for in this moment right now?
Honestly, like the love and support that I have from family, from patients, from, everyone that's kind of around me right now. That's what I'm most grateful for.
And we're grateful for you. It's a mutual admiration society. So if somebody wants to become a patient, how do they do that?
So you can go to my website, www.medicineandwellnessmd.com, and you can click on the top right corner. There's a little button that says become a member. You'll fill out the forms, do all of that. You can also call me 215-703-7377, and I will pick up the phone and tell you anything you need to know about the practice, learn what you're looking for, tell you a little bit about me as well.
Obviously, I'm a huge advocate because here you are on Hidden Human. But
you're the best.
Well, listen, I'm just a reflection of you. You let me be that way because your energy allows that. So
we got to work on our retreats.
Yes. And Cecily on our team is on listening, and we were talking about that. That's a big goal for us, 2024 into 2025. So everybody be looking out for retreats. And if you hear this and you have an idea of what you'd like to see, please reach out because we'd love to do that. But thank you to our audience for listening. It's our intention here on Hidden Human to inspire you to go out and have authentic conversations to deepen the connections in your life. Thank you so much, Lily. Thank you so much to the audience, and make it a great day.